adjustment is recommended? A. Stop metformin immediately. B. Reduce metformin dose and monitor renal function. C. Switch to sulfonylurea. D. Switch to insulin only. Answer B. Explanation. Metformin can be continued with dose reduction and close monitoring until eGFR falls below 30. Page 528, CTC 2018. A 60-year-old woman with type 2 diabetes has HbA1c 8.8% despite metformin and DPP-4 inhibitor. She has established cardiovascular disease. Which add-on is most appropriate? A. Sulfonylurea. B. SGLT2 inhibitor. C. Meglitinide. D. Alpha-glucosidase inhibitor. Answer B. Explanation. SGLT2 inhibitors, empagliflozin, canagliflozin, provide cardiovascular and renal protection in addition to glucose control. Page 525, CTC 2018. Q3. A patient with type 1 diabetes is using insulin glargine and insulin lispro. He complains of severe hypoglycemia overnight. What adjustment is best? A. Increase basal insulin. B. Reduce basal insulin dose. C. Switch to premixed insulin. D. Add sulfonylurea. Answer B. Explanation. Reducing basal insulin prevents nocturnal hypoglycemia while maintaining bolus coverage. Page 534, CTC 2018. Q4. A 48-year-old woman with obesity and diabetes is reluctant to start insulin. Which drug option provides both significant HbA1c reduction and weight loss? A. Pioglitazone. B. Sulfonylurea. C. GLP-1 receptor agonist. D. Acarbose. Answer C. Explanation. GLP-1 receptor agonists are effective for glycemic control and promote weight loss, unlike sulfonylureas or thiazolidindiones. Page 523, CTC 2018, Q5. A 65-year-old patient with long-standing diabetes has HbA1c 7.4%. He is frail with multiple comorbidities. What HbA1c target is most appropriate? A. 6.5%, B. 7.5%, C. 7.5%, D. Individualized up to 8.5%. Answer D. Explanation. In frail elderly patients, less stringent glycemic targets, 8.5%, are appropriate to avoid hypoglycemia. Page 519, CTC Q6. A 58-year-old man with type 2 diabetes has frequent hypoglycemia on glyburide. What is the most appropriate substitution? A. Continue glyburide at lower dose. B. Switch to gliclazide. C. Add insulin. D. Add thiazolidinedione. Answer B. Explanation. Gliclazide has a lower risk of hypoglycemia than glyburide and is preferred in elderly or high-risk patients. Page 523, CTC 2018. Q7. A 70-year-old woman with diabetes, obesity, and severe heart failure is poorly controlled on insulin. Which adjunctive therapy is contraindicated? A. GLP-1 receptor agonist. B. SGLT2 inhibitor. C. Pioglitazone. D. DPP-4 inhibitor. Answer C. Explanation. Thiazolidindiones, pioglitazone, cause fluid retention and worsen heart failure. Page 523, CTC 2018. Q8. A 54-year-old man with type 2 diabetes on insulin presents with painful peripheral neuropathy. Which agent is recommended as first-line therapy? A. Morphine. B. Duloxetine. C. Ibuprofen. D. Acarbose. Answer B. Explanation. Duloxetine and gabapentin are first-line for painful diabetic neuropathy. Page 540, CTCT. A 63-year-old woman with type 2 diabetes is started on an SGLT2 inhibitor. She develops dysuria and increased urinary frequency. What is the likely cause? A. Hypoglycemia. B. Urinary tract infection. C. Lactic acidosis. D. Volume overload. Answer B. Explanation. SGLT2 inhibitors increase glycosuria, predisposing to urinary and genital infections. Page 526, CTC 2018, Q10. A 58-year-old man with diabetes has HbA1c of 10.5% with polyuria and weight loss. What is the best initial therapy? A. Metformin. B. Metformin plus sulfonylurea. C. Insulin therapy. D. Lifestyle modification alone. Answer C. Explanation. Insulin is required in patients with marked hyperglycemia, HbA1c 9 to 10%, and symptomatic catabolism. Page 534, CTC